If you start the journey with proper counseling, due knowledge, expectation management, and all that, give or take, everybody know IVF is not cast in stone. It's not like you go to a car lot, you pay money and you pick your Venza, you pick your G-Wagon and you're driving off. You, the patient, equally have role to play that the clinic have no control over. So when you go 2 weeks down the line after embryo transfer and you're back in the clinic, when we check your blood to check for the pregnancy hormone, if it's there, lucky us. If it's not there, it's a matter of us sitting down together, look at why and what could have gone wrong. What we need to do differently for an expectant mother, for a woman desiring the fruit of the womb. Most of the time, the 2 weeks they have to wait after embryo transfer is like 10 years. They are restless, they are expectant, and they are weary. But from the experience of the years, talking to them on a daily basis, a nurse is assigned to the couple, especially the female partner, talks to them, check on them, how they are taking their drugs, what are they experiencing. The report coming from these interactions under 14 days, it gives you an idea of your probable landing point. When you meet a patient that just had a failed IVF cycle, especially the women, they are actually the patients here most of the time. They went through all the injections, took all the pains, exposed their body all the time and time to the doctor. At the end of the day, for all the stress, maybe they fly down from outside the country, they are traveling from outside Lagos to Lagos State, and the test became negative. Oftentimes they will break down. It is normal for them to break down. Let them pour out the tea. If you start the journey with proper counseling, due knowledge, expectation management, and all that, give or take, everybody know IVF is not cast in stone. It's not like you go to a car lot, you pay money and you pick your Venza, you pick your G-Wagon and you're driving off. Does it mean that that's the clinic did not do the best? Absolutely no. It was just a matter of timing on their own compliance as well. If the woman failed to comply appropriately, the cycle can fail with regard to what she eats, where she goes to, the lifestyle she lives. The social life choices the woman keeps is directly related to how quick she will get pregnant and the chances of full-term pregnancy. There's no emergency about IVF. You might not be in the best frame of mind. You might put a lot of things in the bucket at the same time. Take one step at a time. Come back when you are mentally ready and discuss your past. Discussing your past illuminates the future. An IVF cycle failed, you return back to the team. If you are so convinced they gave you the best, to sit down and do a review. Perhaps there might be need for change of protocol that was used for that IVF. There might be need to change your own approach to the couple back home. The endeavors you engaged in after you left the clinic upon embryo transfer. The timeliness of your medication. Let me share a story with you. We had a couple some time ago. This couple have had about 2 cycles failed somewhere. They came to us. And for all intent and purposes, Omega Golden Fertility will show you your embryos. You will seal them, you will snap them with your own phone. We will have it sent to your email if you so desire. So you could see, and in any event, you could show another professional wherever, however, anytime. This is what I got at Omega Golden Fertility. The person will tell you whether it's the best of the best that was put into you or not. How do you blame the clinic? By climbing your wife. Transfer was done around 6 p.m. or 4:30 p.m. By 11 p.m. in the night, you are engaging in erotic sex with your wife. 3:30 to 4 in the morning, you are back in the woman's room. The woman struggled and struggled. The doctor said no, but he told us now. The man turned his eye and was turning to chaos. The woman had to submit.
Hi there. You are welcome to another episode of Omega Fertility Podcast with Dr. Abraham Pataki. I'm your host, Dayo Fowe. Subscribe to our YouTube channel and follow us on all our social media platforms. Our 24/7 lines is available for you and scrolling on your screen. Today, we'll still be continuing on our IVF failure, the signs, symptoms, and the way forward. Doctor, it's always an exciting time having you on these episodes.
Thank you so much. It's good to have you again.
Well, doctor, I noticed something when I came downstairs.
Okay, today.
Yes. I saw 3 couples. And they are
Okay.
and they are giving their results.
The IVF couple,
Yeah.
that couple, and that British.
Yeah.
Oh, okay. You were downstairs.
Yeah. But I discovered that 2 of them were positive and 1 was negative.
Yes, that's true.
But one thing that fascinated me was that the one that was negative,
Yeah.
he went ahead to embrace those ones that were positive.
Oh, yeah.
What reason can that be?
No, this is it. It's all about how you start the journey with a couple. If you start the journey with proper counseling, due knowledge, expectation management, and all that,
Okay.
give or take, everybody know IVF is not cast in stone. It's not like you go to a car, bought, you pay money, and you pick your Venza, you pick your G-Wagon, and you're driving off. There are procedures, there are professionals that play a role at one point or the other. And you, the patient, equally have role to play that the clinic have no control over. So when you go 2 weeks down the line after embryo transfer, and you're back in the clinic, when we check your blood to check for the pregnancy hormone, if it's there, lucky you, lucky us. If it's not there, it's a matter of us sitting down together, look at why and what could have gone wrong. What we need to do differently, and particularly the clients themselves running with us the itinerary of the journey of 2 weeks since they left the clinic. Perhaps they have done things they were not meant to do. Possibly they were not told, or they were told they forgot, or they took laws into their hands, and the result is there. In any event, for them to see 1, 2 people in their presence jumping up, crying for joy, that means God is around the corner. The expectations will be met. It's just a matter of the time. We were not all born at the same time. They didn't get married the same day. And the result, fulfillment, will come at different time. The Bible established that how the Lord will do it at its what? At its appointed time. And everybody has different time. So there's no big deal about that.
But Doc, I could remember in the last episode, we talked about the responsibility of the clinic and the responsibility of the patient towards the IVF treatment cycle, failure or success. But do we have to wait till that test at the clinic before we know embryo treatment has failed or successful?
The way and manner it is truly told, there are 1 million signs you might be able to see, experience before the 14 weeks waiting period. For an expectant mother, for a woman desiring the fruit of the womb, most of the time, the 2 weeks they have to wait after embryo transfer is like 10 years. They are restless, they are expectant, and they are weary. But from the experience of the years, talking to them on a daily basis, a nurse is assigned to the couple, especially the female partner, talks to them, check on them, how they are taking their drugs, what are they experiencing. The report coming from these interactions under 14 days, it gives you an idea of your probable landing point. For instance, if a cycle is going to fail, they tell the chronicles of events that has to come, the woman might not be experiencing it during the waiting period of 2 weeks. For instance, a woman just had embryo transfer. It is expected that you might experience a mild crying in a matter of days after embryo transfer, up to like 5, 6 days. You might be having some nauseating feelings. You might equally have some stains of blood on your undies, which we call the implantation bleeding. When you experience this, you begin to know that Abraham, Sarah, Joseph, they are on their way.
But those are for the successes.
Successes. Where these symptoms are not there, it does not mean you have not gotten pregnant. You might experience your case differently, which might has to do with constipation. The woman, about 2 months ago, for complete a whole week, to almost 10 days post embryo transfer, she couldn't go to toilet. She eat, drink, but she was not going to toilet to defecate. And she was so worried. Why she was worried? I told her, never mind. Keep doing you, stay to your medications, eat well, rest well, do you. Whatever it is, 2 weeks down the line, we're going to find out. But I knew for a fact that she was already pregnant. Why was she constipated? The embryos in her had implanted. The body had recognized the embryos. The body is already producing embryo, progesterone hormone, which is the pregnancy hormone. It is the rise of this pregnancy hormone that slows down metabolism in the woman. And as such, as she eats morning, night, afternoon, the extract is hiding somewhere in the body until the point there's a threshold that she can push out. So we place her on fruits, pawpaw, watermelon. By the time she does that 2-3 days, she was able to go to toilet with ease. But where all those things missed, you still have a duty to stay religious to your medications until the day we get to your pregnancy test day. And where the cycle fails, it is also possible you see blood flow well before that 14 days. Where you bleed before 14 days, most of the time the cycle has failed. Okay. Bleeding using one pad or two daily is different from you having a stain on your undies. Do you get the difference now? And that is it.
That's the physical evidence or symptoms of IVF failure.
Mm-hmm.
But what are the other symptoms concerning emotional or other physical things that we can see that this IVF cycle has failed?
Sometimes we are different and we take things differently, just like every individual. When a woman gets pregnant, had an IVF done, and embryo transfer done, and the person goes home, when the cycle has not been tested to be negative or positive, their mental state is very important. Some people themselves can prophesy doom. All they think of is negative, negative, and they say it everywhere they go. Is this going to work? After all the journey of 1.5 months to 2 months, you talk to different professionals in the clinic, but yet your mind was never at rest. Worry doesn't solve any problem. It only adds to the problem. All you could do is to keep your hand and you wait. And if you are so much puzzled, reach out to the clinic. Reach out to the nurse assigned to you. If the nurse did not pick your call or missed your call, call the doctor that attended to you. You have a right to have his number. You have a right to have a number, and you can discuss your experience. He'll be asking you questions. How have you been feeling? How is it going today? Were you able to eat? Did you drink this? You explain yourself. And that is it.
So emotional trauma too can contribute to IVF cycle failure.
Oh, yes. IVF is majorly psychological. If you ask me, it is a mental thing. It demands a whole lot on you physically, mentally, and psychologically. So sometimes you see some people that are very informed. They say, no, I am going to pay now, but I am not mentally ready. Let me prepare myself. Let me discuss with my husband. Let us go and enjoy ourselves. Then we are coming back 2 weeks. Give us this month. We have some trips to cover. Let us cover all those trips, become stable, and be mentally ready for this. And as such, by the time they are coming to you, they are coming with all the spice in the world. Their body is prepared to take it. And that is it.
I love the explanation, doctor. Now let us go to treatments and remedies. What are the steps to take immediately you find out that IVF cycle is?
Oftentimes, when you meet a patient that just had a failed IVF cycle, especially the women, they are actually the patient here most of the time. They went through all the injections, took all the pains, exposed their body all the time and time to the doctor. At the end of the day, for all the stress, maybe they fly down from outside the country, they are traveling from outside Lagos to Lagos State, and the test became negative. Oftentimes, they will break down. It is normal for them to break down. Let them pour out the tears, but stay with them. You don't leave them alone. Because that cycle has failed, it's not a proof that you're not going to be a mother again. I kid you not, early this year, we had a patient delivered, and this is a patient that has had 4-5 cycles. I'm being honest. I mean, if you go to our website, there was a couple there that gave us a review. They had 2 cycles in one of the biggest clinics in Nigeria.
Wow.
Does it mean that clinic did not do the best? Absolutely no. It was just a matter of timing or their own compliance as well. If the woman failed to comply appropriately, the cycle can fail with regard to what she eats, where she goes to, the lifestyle she keeps. The social life choices the woman keeps is directly related to how quick she will get pregnant and the chances of full-term pregnancy. Do you get it? So when they did it fail, they went to another center in go, although failed. Another cycle, that things didn't work. But the good thing is that they never lost hope. They always believe things we can work. Along the line, they took their time off. Taking time off sometimes is not emergency. The baby's still going to come. There's no emergency about IVF. You might not be in the best frame of mind. You might put a lot of things in the bucket at the same time. Take one step at a time. Come back when you are mentally ready and discuss your past. Discussing your past illuminates the future and the adjustment that has to be made. Twerk it here, twerk it there, and invariably, they had the 5th cycle. The 5th cycle gave us a boy and a girl. And I'm talking of Deborah and David. Today, David is a genius, sponsored by United Kingdom government. He's in the Republic of Ireland now, not Ireland, under scholarship. While Deborah is an unbelievable, adorable damsel. She can ride forever. You can see after 4 failed cycles, the story has changed. The couple today can never remember their previous failed cycles again. Because these children are about 9, 8 to 10 years old now. At 9, 10 years old, you're already making money from your child. How better can it be? We are not talking of 200,000, 100,000. If you are making 1,000 something pounds on your child every quarter, every time in school, how better do you want it to be? Yeah. So it's about the mental state, preparedness, and the readiness of the couple as well.
I love this story that you brought about and this testimony of multiple IVF cycles. But are there some investigations that you do in your clinic after previous IVF or multiple IVF failures?
No, truth be told, this is how it goes.
Yes.
When you have an IVF cycle failed, it's not about sitting in your home, crying, brooding. Because you hit your foot, you hit your left foot on your way out, doesn't mean you're not going to go to work. It doesn't mean you're not going to travel to see grandma. Doesn't mean you're not going to see grandpa. An IVF cycle failed, you return back to the team. If you are so convinced they gave you the best, to sit down and do a review. Perhaps there might be need for change of protocol that was used for that IVF. There might be need to change your own approach as a couple back home. The endeavors you engaged in after you left the clinic upon embryo transfer. the timeliness of your medication. Let me share a story with you. We had a couple some time ago. This couple have had about 2 cycles failed somewhere. They came to us. And for all intent and purposes, Omega Golden Fertility will show you your embryos. You will seal them, you will snap them with your own phone. We will have it sent to your email if you so desire. So you could see, and in any event, you could show another professional wherever, however, anytime. This is what I got at Omega Golden Fertility. The person will tell you whether it's the best of the best that was put into you or not. You also could go on Google. Oh, day 5 embryo, day 3 embryo, day 4 embryo. Click Google image. What does it look like? That tells you how far the clinic have come in delivery on the assignment at hand. When you see something looking better than what you have on Google image, when you see something that is at par with what you have on Google image as a very good embryo, that means the clinic has fulfilled the mandate of the treatment. So if you now have a failed cycle, what happens next? We need to review as to what happens during that 14 weeks, 14 days. During these 14 days, the woman told me clearly that, Doc, I am going, but I will see you privately. I will chat you. The woman said, my husband, and talk to my husband. Doctor, I cannot lie to you. On the day you did our embryo transfer, despite the fact it was written in black and white, the couple read through it, signed, and thumb-printed. The man engaged in 2 rounds of deep sexual intercourse with the wife. How do you blame the clinic? By claiming your wife. Transfer was done around 6 p.m. or 4:30 p.m. By 11 p.m. in the night, you are engaging in erotic sex with your wife. 3:30 to 4 in the morning, you are back in the woman's room. The woman struggled and struggled. The doctor said no, but he told us now. The man turned his eye and was turning to chaos. The woman had to submit. And the very disciple failed. You cannot be having rigorous sex immediately after embryo transfer and you expect the cycle to fail and you want to blame the clinic. You have to blame yourself. So when they came back, we played a trick on the couple. The woman was put into one hotel that the husband had paid money for. Only 1 day was subscribed in that hotel. A reservation of 1 day was made. The other 13 days, immediately the husband left, we arranged a new hotel in the neighborhood for the wife. So the woman was moving to a new hotel for the rest of 13 days of the waiting period. The husband was calling, where are you? I am safe. I'm with the Omega. I am safe. Hey, but where are you? They say you are not there. Don't worry, I am safe. I don't want what happened the last time to happen again. Honey, let's do video call. You will see me, I am safe. The woman was eating, enjoying herself, watching movie, and praying to her God while she waits for the rest 13 days. Lo and behold, she did pregnancy test, just like one of the ones you saw today. And it was 8,000 something quantitative beta HCG. When you see 8,000 quantitative beta HCG, it automatically tells you are drifting towards multiple gestation. So it becomes buy one, get one free. So it's not just about the literature and the medical textbooks. Sometimes you bring wisdom into managing this couple. Not because the man wanted cycle to fail, but from nowhere, something came upon him and the wife became irresistible to him. And he also could not control himself. He started digging deep, according to the review. He was digging deep. And from digging deep, they dug out.
Doctor, you mentioned something in passing.
Yeah, what was that?
About IVF protocol. When cycle failed like that, do you change protocol or you are regimented on the previous protocols?
No, this is how it goes. There are more than 100 protocols that you can deploy in IVF. And everybody will say they do IVF. But every patient, every couple don't follow exactly the same pattern. There are peculiarities about this couple, about the male, there are peculiarities about the female that inform the choices of the protocol you are going to use for them and the treatment options. So in this regard, when the cycle fails, you review, like I said, what could have been done differently? What could have been done that was not done? What could have been done and dwell on that was not dwell on? What do you have to abolish? You might have to jettison such moves and take another round. And sometimes nothing actually went wrong from the clinic. I'm being honest. Nothing actually went wrong from the clinic. It's just because the patient was not compliant. Truth be told, it's just because the woman became a non-conformist. Imagine we going into an IVF theater, and after sedating this woman with an anesthetic agent, we asked the woman, she was unconscious, how many bottles of beer did you take last week? And the woman comfortably opened up and said, no, not too much. It's only one bottle of Star Radler. I love it because it has lemon. No, I didn't take beer. It was flying that I took. Oh, no, I didn't take beer. Just half cup of wine, red wine. My dear sister, my dear brother, who are you going to blame in this scenario? Star Radler, 4% alcohol, 5% alcohol. Flying 4.5% alcohol. And we campaigned, wrote it in black and white that you should not take alcohol. Stay away 3 months from alcohol before you start IVF. Don't dare red wine, alcoholic wine, no whiskey, no vodka, no Jack Daniel, no red label, no blue label. Be it a man or a woman, once you indulge in all these ties, social life choices, the chances of getting the result is becoming drifted away gradually. And when you do all the when you begin to talk, would you believe we got into this woman to bring out the eggs from her ovaries? If you have about 8-10 follicles here, you have about 5 here. That's about 10-14 follicles. At least you get 10 eggs, worst case scenario 8. Could you believe the follicles were just water? It was 2 eggs we got from this woman. And these 2 eggs, only one was good. That became embryo. We transferred and the woman had a failed cycle. How are you going to blame us in this case? The woman chose a path that suits her, and she was a non-conformist. So why you meet an 18-year-old as a nurse, while you meet a 20-year-old as a doctor, in as much the person is certified to do and take this responsibility by government?
Really, doctor, this brings us to the emphasis on the patient role that they play concerning IVF cycles, whether success or failure.
In actual fact, I would used to put it this way: the profit and loss account of IVF, it really belongs to the patient. They are the one that look for the money. We don't know how easy it is. But one thing we know is we know the economy of this country, how it is. Most clinics don't run 90% charity inpatient treatment. We get paid to pay bills, isn't it? Then when we get the embryo, which is the hallmark of what we can do, transfer the embryo, give them the medications, the lifestyle choices at the peak, after they leave the clinic, it impacts directly. Because like the woman I talked about earlier, who was indulging in Star Radler, and you are not IVF treatment, you don't see wine bottle and take your eyes off it. Despite the fact there was so much discussion on it, it also was written in black and white in your consent form, the do's and the don'ts. When you indulge in such, how do you blame the specialist? How do you blame the clinic? How do you blame the both the patient, the specialist, team, we all have responsibilities in ensuring that the cycle ends in a brilliant smile. And that's what concerns us the most. The moment you get pregnant, we are over the moon. We are celebrating you. You are celebrating yourself. The world is celebrating you. But where you choose another route other than the instructions given in the clinic, then there's a challenge. The common skit people call it kasongo kasongo. Otilo.
You have heard this from Dr. Abraham Fasasi. Life choices matter when it comes to IVF failure or success. Do follow us on all our social media platforms and on our YouTube channel. Visit us and subscribe, like, comment, and share. The 24/7 phone lines are scrolling down at the bottom of your screen. Doctor, let us continue. Let me bring you back to where we first started.
Okay.
That I saw those couples
That the one downstairs.
down there, downstairs. I was not a patient, but I was emotionally, I was emotionally moved when I saw such things. So, what are the emotional counseling and support you give to your clients during IVF treatments and thereafter?
In, like I said earlier on, in all, IVF is more mentally, psychological than the scientific aspect. If you get the best of eggs, the best of sperm, the best of embryo, and the best of hands among the gynecologists, the nurses, the embryologists, any other member of the team, the geneticist, transfer the embryo. If the patient is not in the best mental state, there's a major challenge. It's like you having a very good seed on a bad soil. What are you going to get? If you plant a very good seed on a bad soil, it will only possibly sprout, then wither and die off. Right? But if you have good seed on a good soil, from beginning to the day you harvest, you look at it and you'll be pleased. Right? So when you look at it all, from day one, we meet with them for consultation to work up and all that. We prepare them and engage them in as to what to expect, even from the moment of injection, administration, swallowing of drugs, because these drugs are hormonal drugs. They can cause them to have some moods in and out. That's understandable. But on top of that, stay glued to the protocol and instructions given. And if you are so puzzled, just ask a question. Do you get it? Okay. So I think sometime last year, we had a couple. Everything was so good for this couple. They were so much of a lovely couple. We talk any time of the day. But you know the funny thing? The woman got pregnant and she got constipated. Rather than call the clinic, for 3 days so, I've not been able to toilet. The husband inadvertently became a chef. He got, according to Yoruba people, this chili pepper. Made all sorts of delicacies of vegetable. Made the woman for poo-poo. Homemade laxative. You won't believe that defecating lasted more than 24 hours. The woman had visited toilet about 8 times in the space of 2 days. So when she was feeling weak, she pulled a call through. I said, tell me, what have you done? She said, I didn't do anything. No. It's only vegetable that my husband cooked for me that I ate. Is the husband against the wife getting pregnant? I'm talking the money. No. He was just being a very caring husband. But he was caring in the wrong direction. He was caring with that guide. He was caring with that opinion of the expert. He took laws into his own hand. At the end of the day, they lost it. How are you going to explain this? Incidentally, they will have to do another cycle. So when the patient take home in this point is from the very get-go, you start an IVF cycle. If you get the instruction from the team correctly, go ahead with it and stay glued to it. If you don't understand, call back and ask questions to clarify you. If you are so puzzled, call again. If you miss information altogether, call again. Oh, can I eat bitter cola? If you don't eat bitter cola, will you die? Why is it during this period of IVF treatment that you must eat bitter cola? Or is it from the traditional healer in your family? Absolutely. It is misappropriation. Nothing is wrong. Cola has its benefit. But there are also what we call contraindication. There's timeliness for everything. Oh, sorry, doctor, I have a way to with so I want to eat. Oh. If you are so unsure, the doctor can guide you. Your nurse can guide you. But when you just go ahead and finish, I don't get belay. The day they did embryo transfer is not the day you confirm pregnancy. There's a wide gap of 2 weeks, which is a whole lot before you can be confirmed pregnant. And even when you test positive, oh, hallelujah. I had a couple from California some time ago. This woman is really, it's painful for me because she still doesn't have the baby till now. She did pregnancy test. It was positive, strongly positive. And from the clinic, she was running on the sofa like a toddler, doing a video call to her family people in the village, the husband people in the village. Grandma, I made it. Why blow the trumpet when the concert has not started? God kept a secret of himself. That is why he is still God. If we have known where God sleeps, gone, where the chair again, I can bet you, if Yoruba people no go there, go pursue and say, Baba God, come down. Igbo people no go creep. Nah, Beba, come down. They will take over from Baba God. But Baba kept himself. That's why we are all still respecting him and God cried to him. When you do pregnancy test and it's positive, that is not the time to start traveling to Anambra. That's not start traveling to Ijebu Igbo. You're not flying back to Oklahoma. Stay put. Long distance travel, long haul flight, there are contraindication in IVF, in the early going. Nobody say you cannot travel, you cannot move around. Eat, do you. But don't board GUO, GIG, and they go about Ghana and go to Aneze meeting. You know, concern. If you don't go to the meeting, would they not hold the meeting? Must you? Oh, my manager is already calling me from UK. I don't want to lose my job. People that are living to UK today, are they not going to still get job when they get there? If you want to marry your work, stay to your work. If you want to marry this success, respect the guidelines for success. You understand me? And that's how it goes.
I can see from your clinic, part of your responsibility for this support and is that of your 24/7 phone line.
Yes.
That your clients can reach you any time of the day.
24 hours. There is always, I think there's 3 lines. No, how do you mean? We have 5 lines for this clinic. And there's no way you will call all the lines and there's nobody that will pick. So if I thought you have something you must do now. If you try one line, it's not going through, call the other line. Send message if you're not getting through. And wait until you get response before you take the next decision. That way, we can preserve what God has done for us.
Thank you, doctor. Now, let's move to the way forward when an IVF cycle has failed. You gave us an analogy of somebody that has done IVF cycle 4 times. And then on the 5th time, when they came to Omega Golden Fertility Clinic, was the success. Now, at what point Should couple now consider an
From the beginning, during consultation, when an IVF cycle fails, looking at the way forward stems from the information you have ab initio from the get-go, from the consultation, and your choice of the treatment modality. However, if we are not lucky and the cycle did not work, because at the end of the day, when the patient doesn't get pregnant, we usually have failed. Whether or not there's a problem with the patient or they did one thing wrong, we cannot record that as our success. So at the end of the day, everybody's grieved.
Yeah.
So when we got grief, if you return the patient as yourself, as your family member, as your wife, you begin to feel the pain they feel. Okay, what do you do next? The patient has to open up in reality, not holding anything back. I mean, look at the woman that opened up that the husband was on the sex spree. That's opening up. Oh, I have to travel with my husband for grandma burial. He said I must go, that the family will not be happy if I don't go. That is opening up. If apparently you now did not do anything and the cycle still did not work, then we begin to look. Maybe the woman is of advanced age and we had counseled her for donor egg and she had refused, hoping to try herself and she will succeed. If she has tried herself at the age of 42, 43 and she didn't get pregnant, there's no point flogging the dead horse. The ovaries have signed out of their physiological and reproductive responsibility. So we need to consider a third party at this time. A third party is looking out for an egg donor. Oh, if the woman has been getting pregnant 1, 2, 3 occasions and she's always lost it, then that means we have to be considering either to have some surgery done, an intervention to check the uterus in terms of hysteroscopy and all that, operative or diagnostics. That way, we may be able to have a better joker to fly going forward. And sometimes there are insurmountable solutions in all this. We have to consider a third party to carry the pregnancies for the couple. That is a surrogate mother. That means we're looking for a young lady who has great gynecological and obstetric history. She's given birth before. And if she's not given birth before, her gynecologic history must be very good. And if her gynecologic history is good, we use her, she gets pregnant. At least so far in the first half of the year, we're having about 3 or 4 ongoing surrogacy pregnancy, if I count well. And that does not take anything away from the couple. It is your seed, it is your sperm, it is your gamete complexes, and that is growing. When the baby is born, take your baby to Australia, take it to Oklahoma, take it to Britain, go to the DNA test if you don't trust the Nigerian system that gave you the baby. Go and check. When they tell you, when it comes to Gabriel Afolayan, the baby is 98% yours. Finish. A round of applause for the clinic. That's how it goes.
So some of the way forward that you mentioned is donor program and the surrogacy
And surgery.
surgery. And what of the adoption? At what point do you advise clients to seek for adoption?
As far as fertility clinic is concerned, we are not in position to direct patients for adoption. Rather than do adoption, which they don't have any biological, genetical relationship with, getting baby from what's it called, the motherless baby's home, we don't do that. As far as Omega Golden Fertility is concerned, we don't do that. We would rather collect the man's sperm, the woman's egg, if she has, otherwise the woman's sperm and the donor egg, and transfer it to a surrogate mother. She takes it to term, deliver. In any event, there's still a member of the family that has the genetic material preserved and represented in the newborn. And that allows them to bond a lot more. Because at the end of the day, if they go out to adopt, let's be honest with ourselves, the motherless baby's home, either through the private or government, they're still going to come back checking this baby from time to time. And to be sure that proper care is being given. But when You spend such an amount of money to get your baby. How many couple since they're newborn that is not deformed, crying like a little baby? Some even pee first time bang, on the face of the father that will not be happy. Say, oh, baby, my baby, my baby. And you see this genuine joy, as in deep joy, resonating from their faces. They can't wait for the baby to grow and walk around with them. So, as far as instead of adoption, we campaign for surrogacy. We preserve the family continuity and genetic continuity. And that way they are happy and they are far more fulfilled than adoption.
Well, thank you very much, Doctor, for that way forward. And now, one more last question. What are the coping mechanisms that you will recommend for couples who are going through IVF failure?
You see, one of the reasons we have these challenges after failed IVF cycle, it still borders on economic pressure in this part of the world. You know, maybe the couple have to save for like 6 months or a whole year to afford one IVF cycle, and that cycle now failed. If they don't speak out, nobody's going to help. Sometimes you need help, and you cannot do it alone. Speak to the clinic. If you are truly a family clinic with genuine empathy, there will be where they come in and meet you halfway, all in the name to ensure you smile away. And if the 50% or whatever percentage discount they gave you is still difficult for you to raise, you can speak to family and friends and well-wishers that we need help. It's either now or never. We need to get it right now. By the time you go at it again, for what you went through the first time, you possibly will see one way or the other where you adjust yourself and put yourself in rhythm for success. And above all, I always tell patients, there's no superstar anyway. If you like, get the best doctor from Boston IVF in the United States. Get the best doctor from Cleveland. Get the best doctor from Bon Hall. All these clinics I mentioned also record failed cycle from time to time. You have to pray. Prayer changes things. That is what I'm going to take you to take away from here today. When you start the journey, commit the journey into the hands of God. And if you have a prayer team, maybe your church or pastor, who you know is a genuine pastor and he loves your family, Daddy Gio, our regional pastor, we are going for this. You don't have to tell everybody, just confide in the pastor to support you, because prayer changes things. I have seen and I have handled XYZ, that is HIV cases, wherein not 1, not 2, not 3, not 4, not 5 in this career journey, that the babies were born and there's no HIV in these children. There was no seroconversion, and couple are fulfilled today and they're happy. When you put God first, of course, the professionals are going to do what they needed to do. They're going to look for the money to pay. But then, don't put prayer as the last thing. Prayer changes things, and it can make what is dead to rise.
Thank you so much, Dr. Abraham Fasasi. Concerning IVF failure, you are not alone. There's someone to support you. Be there and be hopeful, and believe that God will do it. On that note, we thank you for staying with us on this episode of Omega Fertility Podcast with Dr. Abraham Fasasi. See you next time. Do follow us on all our social media platforms and on our YouTube channel and on our 24/7 phone line scrolling down on your screen. Until next time, when we come your way, thank you very much. I remain your host, Dayo Fowe.